Parkinson's disease affects millions of people on a global basis, affecting about 13 per 100,000 people, with thousands more being diagnosed every year. But what exactly is Parkinson's disease, and how high is the risk of someone developing this disease? Parkinson's is a disease that primarily affects the brain, impacting both the patient's mental ability and the patient's physical ability. The disease targets the areas of the brain responsible for the individual's mobility control and ability to balance. This means the person may lose their muscle function and suffer from tremors in the limbs. Additionally, the disease often causes further brain damage, resulting in hallucinations, various mental illnesses, and memory impairment. The cause of Parkinson's disease is generally not credited to heredity, although it is autosomal dominant, but instead credited towards genetic variations. While there are multiple other genes that have been attributed to the development of Parkinson's, 5 genes especially are the most explicitly linked to the development of Parkinson's disease. In addition to genetic factors, Parkinson's can also be influenced by environmental factors such as external toxins and chemicals.
The genetic variations that 23andMe tests for are G2019S variant in the LRRK2 gene and the N370S variant in the GBA gene. The most important variation is G2019S due to it because it's the most common genetic mutation when discussing Parkinson's disease because it significantly increases a person's chances of developing the disease. In this variation G2019S, it significantly impacts the LRRK2 protein, which is leucine-rich repeat kinase, which is primarily responsible for protein trafficking and maintaining the cell's internal structure by adding phosphate groups to proteins that control their activity by changing the sequence of the amino acid, causing kinase activity to increase and leading to an abnormal amount of target proteins to phosphorylate and then cause an unusual amount of cellular processes, which can later cause potential neurodegeneration and lead to the development of Parkinson's disease. This protein is expressed in immune cells, peripheral organs, thalamus, but mainly expressed in brain cells, like microglia extraordinary and oligodendrite pursuer cells. These variants make sense to have in this trait because if it wasn't these specific mutations on these specific genes, then this disease wouldn't exist. It would be completely different. One of the major limitations of this 23andMe test is that it doesn't include all the genetic variations that will increase a person's chance of developing disease, meaning that they don't test for all the known genes.
To design an SNP chip test for Parkinson's disease, we would select genes associated with the disease such as LRRK2, SNCA-GBA, PARK7, and PPKN. These genes contain SNP that are known to contribute to disease risk, with each variation potentially impacting protein function and cellular processes relevant to Parkinson's pathology. Including these variants and others like G2019S, LRRK2, and N370S in GBA, the SNP chip test design would use hybridization-based platforms such as Illumina's and Fumium, which allows for thorough genotyping for specific SNPs with high accuracy. A risk-scoring model will weigh each SNP according to its impact on disease risk, providing individuals with a personalized genetic risk for Parkinson's. By customizing the array to include only Parkinson's-related SNPs, the test can reduce costs while maintaining a focus on relevant genetic markers. By following this approach, we can hone our screening process rather than a consumer test that screens for thousands of SNPs across various traits, many of which may not be related to Parkinson's. By adding these considerations, this SNP chip test intends to be responsibly administered and scientifically strong, presenting enhancement over consumer-level tests like 23andMe. 23andMe offers a Health Plus Ancestry service that has genetic health risk reports for Parkinson's disease, examining specific genetic variants that may increase an individual's risk. The test specifically focuses on variants in GBA and LRRK2 genes, which have both been linked to greater likelihood of developing Parkinson's. Using its custom SNP chip test, 23andMe scans for these variants, enabling individuals to understand whether they carry genetic markers associated with Parkinson's. Unlike 23andMe, our test would include additional variants linked to Parkinson's to provide a more comprehensive genetic risk profile. For each SNP, the test should assess its effect on protein function and its role in disease progression. Including these SNPs will provide a more detailed understanding of individual genetic predisposition rather than 23andMe's general screening.
Genetic tests may not provide all the possible gene mutations, causing difficult decisions needed to be made by families. Mutations in recessively inherited genes have been described in late-onset patients, and conversely, mutations in dominantly inherited genes have been found in early-onset patients of Parkinson's disease. It can cause people to feel angry, depressed, anxious, or guilty about their results. Despite the heterogeneity of Parkin mutations and efforts to evaluate genotype-phenotype correlation, there is not a specific clinical feature that is a diagnostic of Parkin mutation carriers. Our genetic tests may provide limited information about a condition, meaning it can't determine if symptoms will show, how severe it will be, and if it will progress. There may be false information from getting genetic testing. This can also warrant undesired options after getting genetic tests done because it creates additional decisions for people to have to make when they didn't know they needed to. Individuals with the variants LRRK2 and GBA had increased psychological reactions of distress and uncertainty after testing positive for Parkinson's disease. Others were frustrated with the preventative options such as clinical treatment or management measures that slow or stop progression. Sometimes there is a lack of confidence and knowledge from providers, which can cause them to not be comfortable counseling patients about genetic testing. There is a lack of insurance coverage, which is why clinicians don't order genetic testing, in addition to anticipated negative consequences.